I mean, could a periodontist or a general dentist argue and say, I don't know, that there's not enough evidence that these lasers work yet? Could somebody say that?
Well, somebody could not say that there's not enough evidence that the lasers work, because we have plenty of evidence.
But do they say that? Do they say that?
Oh, absolutely. There are many dentists out there. And
I spoke to a Dr. Heller, as a matter of fact. He says, Randy, there's not enough evidence yet.
Yes.
At least for him.
Yes. People do still say that, but if you go and read the research articles very carefully, the research is there. I was actually one of the ones who was on the fence with this laser treatment for a long time. I was skeptical because we as periodontists, we are trained to be very evidence-based. We are trained to be very research-oriented. But nowadays, there's so much research out there on this topic that is very convincing. As a matter of fact, respected clinicians like Dr. Stephen Brown from Philadelphia, or several of the periodontists who are on the board of directors of our governing body, which is the American Academy of Periodontology, are using lasers. So more and more periodontists are evaluating the research and seeing that it has shown to be effective, and basically starting to incorporate lasers into their practice. Number one, there are different types of lasers. So a lot of the lasers that general dentists have may not be suited to treat gum disease. There are lasers that are specifically done because of the specific wavelengths of the lasers that have specific protocols to treat the gum disease. As a matter of fact, you have to have special training in order to be able to perform laser gum treatment. So not all lasers are alike. That's the first thing.
So the conventional method of treatment was, how do we get rid of this pocket so as to make it easier for the patient to clean? So if this was the pocket, the only way to get rid of it was either to cut it off or move it down. What does that do? Well, it gets rid of the pocket, but what it also does is it leaves the patient slightly disfigured. You have long, sensitive teeth. You've got teeth with spaces between them.
But that's how it's being done every day. Today. Is that right?
As we're speaking here, it's being done in thousands of offices across the country.
And that's now, cutting it out, cutting out this infection.
Cutting it off or cutting it out, one or the other, however you wish to say it. The fact of the matter is, there's nothing intrinsically wrong with the idea of doing surgery, but there's a much better way, because the surgery is treating the effects. It's not treating the cause.
And the cause is a bacterial?
The cause is bacteria. Okay. Never forget the fact that the bacteria are the cause, and that is the reason why the laser gives us options that we never had with the more traditional, I like to say, antiquated therapy.
And now when you talk to doctors about this, because I guess in your field you are the gum specialist, the periodontist, right? Is that right? It's divided. Right? Some say, you know, because I look, anticipating this interview, some of the periodontists say, Randy, I'm not ready yet. I'm not ready to do it. I don't know if there's enough evidence. I don't know if it works, they say.
We're heavily divided. Okay?
So does it work? Let's start there. It works.
It absolutely works. First of all, not only does it work, and I can talk to you about the clinical results, but it works because we have research evidence published in refereed journals read across the world that say that this works. So there no longer can be any doubt that it works. Someone could have a different point of view.
Do you do surgeries anymore? For pocketing? For
I'm going to give you a statistic that's probably going to knock your socks off, okay? In the last almost 2 years, I have not done one flap surgery, and flap surgery is the traditional surgery.
For gum disease?
Flap surgery for the sole purpose of eliminating pockets.
A pocket.
I haven't done it once in the last 18 months to 2 years.
There's
a reason for that.
So you just use the laser?
I use the laser. I use the laser routinely for a number of reasons, most important of which is it attacks the cause. It attacks the bacteria. The fact of the matter is that laser energy, light energy, all it is light, has a fantastic ability to be attracted to colors. And the fact of the matter is that the bacteria that cause periodontal disease have 4 colors: red, yellow, orange, and black. And so the laser energy goes right through the tissue, deep into the tissue, kills the bacteria with no collateral damage to the other tissue. So it's safe, it's effective, it causes the bacteria to be killed on the spot. Consequently, when we get rid of this bacterial activity, the patient's own ability to heal takes over. And we don't have any of those side effects that I spoke of before.
Now, what about pain? When you compare the two pain-wise, I mean, what do patients say? Because you got the laser therapy, and then you have the traditional cutting and stitching.
Once again, absolutely no comparison.
Really?
The routine for me over the past 25 years or so, first of all, I've been teaching this. I still continue to teach surgery because one needs to learn the basics. But over the past 20, 25 years, it was routine for me to prescribe narcotic analgesics for patients. Sometimes they had swelling and discomfort for a number of days.
With traditional surgery?
With traditional surgery.
Gum surgery, okay.
If we were doing it in more than one area of the mouth, they didn't want to come back and have it done again. So we went to doing it full mouth, which made it even worse for many people.
Very painful.
Yes.
So the laser?
This is entirely different. Entirely different.
Okay.
I have patients, I call all my patients the night after their surgery. Routinely they're telling me, oh yeah, I took a couple of Tylenol. Yeah, one tells me I had some Advil. That's the most, and they're done by the next morning.
So you just go around with a laser, zap it out. I don't want to oversimplify it, but you're like killing the bacteria.
That's right.
And the bad breath goes away.
In fact,
is that right?
Sure. We fix the problem and you change the person.
Good.
Fix the problem and the person comes out of the shell. And I want to tell you, that is what really gets me up in the morning. That is what's reward.
You love this.
I wouldn't be doing it as long as I have and teaching as much as I do and spreading the gospel, and I hate to use that terminology, but that's what I'm doing. Spreading the gospel of a technology that's available today to everyone that is without comparison. And by the way, it's important to know that not all lasers were created equal. Physics is different. There is only one laser that is FDA approved and a patented protocol for treating periodontal disease. And the only one is the Periolase laser. That's the only one that has been approved. That's the only one that's been researched. That's the only one that will do the kinds of things that I've been talking about. There are many different lasers that will do many different things, some of them destructive. Those are not the ones we want to be using. So you go and you want to ask, does my periodontist have a laser? And if he has the laser, make certain that they've got the Periolase laser, because it's the only one that has university-based studies proving that it works.
And yes, we do have a link between all these bacteria that's inside the mouth. It's a direct connection because of
if you have blood in your mouth, it's going into your bloodstream, right?
It communicates, exactly. So
interesting.
What we have is all this information going to different body parts. So there's a direct communication with patients with cardiac issues.
Were you skeptical? Because look, I've talked to periodontists.
Absolutely.
They are divided, it seems like.
By nature, I'm skeptical because I always want evidence-based
Because you're
therapy.
trained in surgery, is that correct? To get rid of gum disease.
I've always looked at evidence behind anything I offer my patients. So this, initially, yes, I was skeptical, but the research is out.
Is there science behind this?
I mean, when we first adopted the traditional approach, there was one paper, one of one. You know, the periodontal therapy with lasers, there's a lot of research.
You've been a periodontist practicing for over 11 years.
Yes.
Okay. When you, back then, would you have poo-pooed this and said no?
Absolutely, yes. And I did. Because lasers have been out for that long. But the research obviously was weaker back then. And now with just like anything in medicine, things develop.
I had a hygienist tell me, by the way, recently. She goes, the lasers don't work. They even could burn the roots of your teeth. So what do you say to something like that?
There's no truth in that. I mean, there's plenty of research
showing
that they do work. There's plenty of research done correctly, like anything else that we do. It needs to be employed correctly.
So no more bleeding gums, bad breath, you get stronger teeth.
Stronger teeth, and hopefully save your teeth.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.